Great. Well, welcome everyone. My name is Emily Bell, and I'm the co-director of the National Colorectal Cancer Roundtable. So first off, thank you so much for joining us. We're really excited to present this new resource to you and for all of you to get started with using it. So the purpose of today's webinar is to introduce you to the new online component to the Roundtable's Paying for Colorectal Cancer Screening Navigation Toolkit. The original release was in 2017, and it was designed to provide healthcare professionals with practical advice on paying for and sustaining colorectal cancer screening patient navigation. The toolkit has been updated for 2019, and we're also releasing a new interactive website to provide additional technical assistance training modules to further support you in your screening navigation work. So we'll start with a brief overview of the tools and then hear from an expert in the field, and we'll have time for Q&A at the end. So my co-moderator today, if you don't mind advancing to the presenter slide, is Andy Dwyer of the Colorado School of Public Health. And Andy is both an NCCRT steering committee member and evaluation and measurement task group co-chair. She provided the vision and leadership for the project back when we started in 2016, or maybe even before that, involving over 75 individuals and organizations in contributing their expertise. So Andy will preview the new website and will also introduce to us Victoria Brenton of the Iowa Department of Public Health, who's generously sharing her time to help walk us through how to use this new resource. And Chastity Dolbeck of the Coal Country Community Health Center is unfortunately unable to join us today, but we'll get to hear from her in a video, and she also contributed a lot to this work. So I'd like to share just a few housekeeping items before we get started. First, we're recording today's webinar, but the replay will be shared with all of you within a few days. And please feel free to share with your colleagues that were not able to join us today. And then also, because of the large number of participants, we're putting everybody on mute during the webinar itself. But having said that, we still want to make sure you get what you need. So be sure to include any questions you have in the chat box, and we'll be getting to those at the end of the webinar. And finally, we're always trying to improve our webinars. So within a day or two, you'll be receiving an email with a survey link to a brief evaluation, and we'd greatly appreciate it if you don't mind filling that out for us. So with that, I'm pleased to turn it over to Andy.
Okay, great. So thank you so much. I really want to say that I really have valued all of the support and resources from the National Colorectal Roundtable. And Emily, thank you, and Caleb and Mary Doroshank, when she was formerly in the role, for really devoting a number of resources to this work. So for today, what we are going to do is talk about, as I talked about, really what was the foundation of the toolkit, and talking about those foundations of sustainability, the online portal, the assessment and approaches that are tied to this work, its technical assistance, and then we're going to be hearing from the implementation strategies from Colorado and some of the work we've implemented, and then also looking at the team in Iowa and their approaches as they're considering all of the tools that have been developed as well. So just a quick heads up, today we really will be talking about approaches to how to make sure at every point of the continuum you're thinking about sustainability. And part of this is really part of our mentors at Washington University in St. Louis. When we talked with them a little bit about sustainability, we asked, should you be considering sustainability, at certain points? And the question was like, there's really not ever a bad time to consider sustainability of your programs. It's okay to do it retrospectively, but it's also okay to work prospectively and really thinking about your sustainability components and how all this works for you moving ahead. And when I asked it once, was there ever a time that sustainability planning just doesn't work? And they said, well, honestly, if you have absolutely no buy-in in your team, it shouldn't be something that you should consider. But I think with many of you showing up today, that navigation is something that a lot of folks have either devoted time, want to devote more time, and think about how to continue this work. So I would say that 99.9% of you have the opportunity to really apply sustainability approaches and make it work, regardless of where you are in the continuum. So let me tell you what will not happen today. So I think that on occasion when we've hosted these webinars, there are folks who wanted to learn about implementation of navigation programs, the how-to train navigators, and maybe even a specific billing code that really is going to unlock and be the silver bullet of sorts to paying for navigation. We're not going to be able to address those things today. It's about a whole part and a whole component and a whole suite of things when we're talking about sustainability. And there's some fantastic resources that I'm going to share at the end about implementation of the how to navigate how to train navigators, how to develop that type of program. But again, the orientation today is really such that we're going to be very much talking about the sustainability strategies for those who are planning programs, developing programs, or wanting to move their programs ahead. So this is actually the version 1.0 of the toolkit that was released in 2017. Several of you might have been part of that inaugural launch of that Paying for Navigation toolkit. I'm excited to tell you that the 2.0 version is now updated. We are going to be visiting the site where everything lives, so you'll have access to all of this information moving ahead. But we're really excited because we were able to update some of the timely updates regarding our accreditation measures, new examples, freshen up info that just, of course, becomes stale over a bit of time. Those dreaded web links that somehow within 5 minutes, they were working one day, not the next. We've refreshed all of those so that you can navigate to all of the great tools that we mentioned as well. So let me just say that the Roundtable has done a phenomenal job of updating the resources on the NCCRT website. And then in the actual portal that we've developed, we've actually put this hard version of the toolkit with this online component so that they are really connected. So before we start getting into the nitty-gritty of the framework, of the online tools, and the sustainability facets and all the tools, I just want everybody to take a few seconds, and in that fantastic chat feature, I want you to think of sustainability and what does that mean for you. And so I want to say that the toolkit is talking about paying for patient navigation and screening navigation, and that's a huge part of it, and for most that's an end goal, but there's some components that must be considered for sustainability to achieve that sort of measure. So in the chat, if you guys will just engage me, if you can go ahead and write down a couple of things that you think about when you're thinking about sustaining cancer screening or patient navigation. So what are some essentials? So go ahead. Oh my gosh, I have a first one. Somebody's already responding. Man, engage leadership, integration into mission, reliable reimbursement. Fantastic, love that. Anybody else? Can we get a couple other folks providing some good chats about what you think that would be? Funding, staff capacity, workflows. Victoria might have read ahead. Yes, very good. Anybody else? Anything that you can consider writing in the chat? Funding, yep. So paying for it, funding it. We have the engaged leadership. Providers that are advocates to follow up on results. That's exactly it. Follow up and making sure that that happens and showing those follow-up results, funding. Yeah. So these are really the things that we're considering in general, but there's actually more to it, I think, and actually not should say more to it, but I should say that what we know is that it's more than just about the money. We know that on occasion there are flush programs that have navigation, have navigators, are funding those, and then a small glitch or small switch in something can end up changing the framework in that someone will no longer be able to use funds that were once available to fund navigation. So one of the things that we talk about in terms of the formative grounding of this work was really looking at the sustainability toolkit and the fundamentals that we've used from WashU around thinking about funding stability, partnerships, organizational capacity, the program evaluation, adapting your program, communication strategies, and environmental support, oftentimes known as policy support, that you really need all of these things to be working in tandem to really be sustainable. Because again, if you don't have that sort of support, communication, adapting programs, that money might be here, gone tomorrow. And I think that WashU had a fantastic basically like graphic that shows that one thing leads into the next, and so that you really need to have all of these components really working harmoniously to help sustain navigation. So when we developed that toolkit, the one that I just showed the portal for, it was really based on that foundation. And some of the feedback that we heard from folks who were utilizing the navigation toolkit is that ultimately, you know, it was put together as a choose your own adventure. There were pieces and parts you can jump in where you wanted, and it's meant to be utilized that way, but there is a lot of information. And so when I was getting a lot of requests for people to explain briefly what's in the toolkit, how to make it all work, how to maybe start with something that's a lighter lift and to make it interactive, and how to really pull out the biggest thematic parts, what would we consider? I was getting asked to present a lot, do a lot of webinars. And then when talking with Mary, Caleb, and Emily and team, we had talked about really the Roundtable's interest in making something that was actually interactive and that could really give, again, the basic like main ingredients from the toolkit, how to really get people's hooks into the information, and then being able to use that actual toolkit in the hard version as more of a workbook and a place to really dig in once people had an idea of what those real thematics look like. So I am going to actually share with you all the online toolkit. So I want to just make sure, can everyone see my slide? Can you see my current, I might need to move it back over, but Erin, can you see the online component?
I can. That looks better. Yeah.
Okay. I think I was moving it over. There's a part of the Zoom component that's actually moving into it just a smidge. But we'll go ahead and jump in to right now talking about, I might move it over to actually, sorry about that. I'm going to move it over to this space again. Anything, Erin, specific that you think I should do?
You might want to just stop share and reshare. That's
okay.
the best way to do it. And are you going to share any audio components with this?
Yes.
Okay, make sure that you select share computer audio, and then that will enable everyone to hear.
Okay, that sounds good. So right now, I think because I have the unfortunate situation where I have this on something else, it might be cutting off just a smidge. But we really have the opportunity with this online toolkit for people who are first time jumping in, who want to look at the full toolkit, or just jump back into where they may have started to ultimately jump into the site. So for first-time users, and just to give us an idea of what the layout looks like and how the information is formatted, we presented a nice introduction that talks about how to use the toolkit, why we developed the sustainability toolkit, given some specific examples of the toolkit in action. So in this specific component, Ann Carlson, who is the president and ED of the Colorectal Cancer Coalition, talks a bit about she was looking for basically a foundation and rubric to consider for evidence-based strategies and how the people she was funding for her navigation programs might look to sustainability. And she had basically implemented the toolkit at large with all of her grantees when they were funded to consider the navigation elements and sustainability components. So it was great to have Ann share a little bit of her perspective. We have Dr. Jim Hotz, who talks about the strong recommendation of navigation in his work as one of the medical directors in Georgia, and who's been very integrated into the work and talking about navigation being as effective an intervention as even some pharmaceutical interventions as you think about outcomes for health and the like. So we're not going to spend a ton of time going through all the tutorials and every out piece in terms of the video component, but this really does give a bit of an idea of how do you use the toolkit, that this is an online component, that there is the larger toolkit that is actually a complement as well. So if we want to jump into basically the home, oh, excuse me, let me jump back in, and really jump into the actual toolkit topics, what you'll notice is we have the availability to see the areas that we want to consider. So the sustainability framework, the evidence-based, how people are integrating the navigation and sustainability components throughout the country, payment approaches, how quality and accreditation fit, economic analysis and policy standards and evaluation. So these are really all of the complementing components in the hard toolkit, but when we jump into, like, let's say even the introduction, we can see just really what are the quick and dirty things that are most relevant to what's happening in those specific chapters. So for instance, in this component, Dr. Freeman talks about the work and why navigation is essential, the sustainability framework. If we can go to the toolkit itself and see the chapter on the hard version as it's connected, but we can also in the online tool see again the most salient themes that are noted from the hard copy version that are now online and that also have more of an interactive format. So when we're looking at this format, and it's just taking a smidge to load, we have an opportunity to look at Dr. Doug Luke and Kim Pruitt, who actually are the people who developed the tool itself, and that we've adapted the sustainability model to meet our needs. But we've actually have opportunities where each one of them share the perspectives around each one of these sustainability areas and what does that really mean for folks. So in the toolkit, you can see it. When I describe it, you can see it. But this toolkit and online component really gives an interactive opportunity to also hear other experts, key thought leaders in these areas give snippets of information about how to further integrate the work that you're doing. So again, the introduction section of the toolkit itself unpacks or has some of the additional resources and components, but in these chapters in the online component, it gives really the most basic information, interactive opportunities for you to really think about the information and how it really relates to the work that you're doing. And then as you're getting more comfortable with the components, you can move between chapters and see really what's also relevant to these main fundamental components as well. So for instance, in this chapter, we can also, from the toolkit, and the way that it was laid out around different state, region-based, and the like, this opportunity gives an idea to understand how people have used that, using that sort of framework. We get some really great examples from throughout the country of who's doing what in these specific domains to really look at sustaining their programs. So again, it's a really awesome opportunity to see the most essential information, but if we want a chance then to go back to the very, really the toolkit that brought us in, we could really go back to this tool, and then which was just updated in 2019, and then see some of the more robust information, tools and instruments that are connected to the specific work that we're talking about. So we had just seen, for instance, in the introductory sample, and then on the online tool, we saw the state and region based, but when we jump into the toolkit itself, we see a little more information about what's going on with these specific states, and some of the very specific instruments, and some of the tools that have been very essential to their work as well. So the online tool, of course, gives us a really nice opportunity to see the fundamental information, to see it laid out interactively, to see it laid out with the nice graphics that really pull you in. But as we really get to examine some of this work, and as people become more engaged and want to unpack really what's going on, the online tool connects to the hard copy version and provides even more robust resources as well. So these are some of the things that we've actually been very excited about in terms of the resources and how they really interact together. So for instance, in the actual toolkit itself, and I'm trying to hopefully not make everybody sick as I'm scrolling through, but we've given some specific examples of the different chapters about where people can connect to the different resources, the tools as well. So again, for many of you who had an opportunity to look at the tool and the hard copy tool, we really are hoping that folks will have also that opportunity to engage in the toolkit, but also, sorry about that, and then ultimately looking at the online as well as looking at the hard copy to really jump in to help further their work in this area. And let me go back really quickly. So one of the things that I also wanted to mention, and again, we have the different opportunities for the different sections, and so we've seen the introduction, we've seen the payment approaches for the different state, local, and regional areas. As we've described, we've talked about the economic analysis, the business component, but we also have tried to make sure in the hard copy version, but we also tried to make sure is that we really plug down to the audiences that we're interested in engaging on the site by really trying to meet people based on their program planners, or if they're evaluators, policy advocates, clinic managers, and even navigators, to really think about their specific role in the work. And so we, again, because so much of the information that has lived on the online or in the hard copy version is really quite dense, and it's very useful if you're thinking about exactly how it fits for you. This toolkit and the online component really gives you an opportunity to just see the fundamental information. But I think in addition to having that hard copy toolkit, which we've shown, and then also this online component, the one thing that I'm also very, very excited about is that working with WashU in that sustainability framework that we have shown, that's been shown as the foundation of this work, when we were talking to WashU about the work that they have really demonstrated, they've talked a lot about that people needing to really assess where they are with patient navigation and sustainability, that there has to be something that really, really helps think of them about what are the key questions they should be asking. And then WashU had actually developed a rubric and a rating system that would give people a bit of an idea about where they are with all of those main constructs of sustainability. So with this online tool, in addition to providing the general information about the tool, the ultimate tool itself and what it holds, the different toolkit chapters, we're also able to or asking people if they want to assess where they are with these topics and to sustain. There's ultimately a 10-minute module that will ask a very interactive session for people to fill out, to think a little bit about what's happening within their programs, where are they with environmental support, clinic champions, their funding, and the like, and even going through this process, ultimately getting a hard copy of an assessment that will be provided after going through this work. So one of the things I'm super excited about is really this complement of resources, but then after you've had an opportunity to really see the fundamental constructs of that work, the different examples, people who are putting this into action, the tools that are in the hard copy version of the toolkit, you're also able to really stop and think for yourself with what I've seen and where my team is, or where I'd like to go individually, where do we think we can go and you can help really assess your sustainability construct areas. So from the actual usability of the slides themselves, as I was mentioning, so when we have the opportunity to really look through all of the components, as I mentioned, which you can see here, and we've gone through a couple of those, the actual the assessment that people can also utilize is also embedded within the actual toolkit itself. And so at this point, really examining the hard copy version of the toolkit, the online toolkit as well, and really engaging, you can also then assess and really think about those core constructs around sustainability and how they relate. So this assessment is embedded within the online component. What's very fun about the whole piece is it then gives actually a scoring and a rating to show you ultimately where you are as a program and some thoughts and considerations for your teams as well. So ultimately, when we really, again, what we were really looking for in the development is that hardline or that hard copy version that we have, the full toolkit, and then ultimately this online tool that really unpacks, again, the major themes, and then an assessment opportunity for people to really consider where they are with their sustainability strategies and giving some feedback as well. So I'm really excited that this actually is something that's worked quite well for our different programs all throughout the Colorado region. I'm going to share a little bit of the work that we've done based on this curriculum, and I know that several of our partners are in the audience, and I'm going to have our team from Iowa share a little bit about the work they're doing and how they've applied this work too. But I think I would just really encourage everyone from this group to take some time to really think about your sustainability strategies, taking some time to really look at where you are right now using these instruments and tools, and utilizing some of those assessments to think about how you're scoring based on those specific constructs, and then really coming back to those online tools as well as a hard copy version to think about planning and how do you utilize the resources that are embedded. So I'm going to actually go ahead and share screen again back to the here we go. And Erin, can you see right now the screen?
Yes, the Team Online module.
Yes, okay.
Yep.
Sorry about that, everybody. So when we developed a lot of this online work and the modules as well as the toolkit itself, we were talking about 100 folks from all throughout the country who provided some great examples, the tools around all of those sustainability areas. But one of the things we were really excited about is that with the American Cancer Society support and help, we were ultimately able to bring in a team of folks from throughout the country who were trained around how to provide technical assistance related to sustainability strategy and to move this work ahead. And so with working with the Patient Navigator Training Collaborative, Dr. Patty Valverde Aaron Martinez and team who helped us really connect with folks. And then a number of people such as Eric from the Rhode Island area, people who were part of that team that we just showed the picture. We've seen Chastity Dolbeck, who was not able to make it today, Victoria, who's going to be sharing, Lucille Johnson from our team, and some of our Colorado folks. We really spent a lot of time saying that if we're going to implement this toolkit, people will have access to this online component, and then for these sort of assessments, you know, really what do you do with this information and how do you make it real for teams? So we're really excited that in addition to these online components and others, that we've also created some curriculum and some technical assistance approaches that will help teams, groups, clinical and otherwise really think about how to meet their sustainability strategy. So when I mentioned, of course, that specific assessment, when you take this assessment, you run through these questions that really relate to those constructs. You get a printout, and it really talks about, based on your responses to those specific questions, really how well you're doing in specific areas and specific domains. And I think one of the things that we've really encouraged our clinic systems, people who've used this tool, is to know that every one of these areas is an opportunity to either see your success or see an opportunity for growth in the future. So in terms of the scale that was developed by WashU in this assessment, which we've adapted to be very connected to preventive screening, the overall top score is a 7. But what you can see is when Aaron took this specific assessment and we were considering some of our programmatic approaches, there are certain areas where Aaron had really thought that her and her team were doing exceptionally well for the program that she was reviewing. So around engaged leadership, really thinking about monitoring and evaluation, but there are some areas like funding stability that are actually quite low. So one of the things that we've really done with this curriculum and all is really encourage and see where people can draw on these successes, but also ultimately in terms of folks really thinking about sustainability goals, thinking about choosing domains where they can really concentrate on focus and making some meaningful action in the next 12 months. And really not only just thinking from the individual, but ultimately thinking from team approaches, that if you can really pull in a wider audience and think about sustainability, your chances of becoming sustainable are even more so. So we're really excited because I think that online component, as well as the hard copy of the toolkit, are also then resources that people can go back and see from leaders in the field, from the different components about how to pay for work, different approaches to paying for quality measures and the like. You can really help consider where you're at and where you're moving. So again, I think what you've seen is that although Aaron had definitely noted some of their areas are exceptionally high and doing very well, there's 1 or 2 concentrated areas that they might need to consider, and that focusing and engaging on these specific goals can be iterative over a period of time. But again, when we saw that wheel, we're really thinking about, even though you might be strong in these 1 or 2 things, it's about really kind of thinking about all of those in a really harmonious sort of situation, so that it's never losing eye on the prize. But if there's some specific domains and areas where you need to focus based on this rubric and ultimately looking at those sustainability foundations, you can really devote those and to make sure that you're continuing to work and that everything stays in balance, as we said from the beginning. So what I'm really excited about is with the work that we have and the tools we've developed with the National Colorectal Roundtable, for the toolkit, for the online component, for the integration, we've actually begun to develop and integrate this work in Colorado, and we started with 5 of our health systems who are part of our statewide navigation program, and in the last year, with these specific resources and training complements and the like, we chose 5 health systems who've gone through this very dedicated approach, have gone through the assessments, have actually then met as a team to consider where they rate low and high, and then as a result, what are they developing for actions over the next year to really think about sustainability. So I'm really just encouraging all of you that with the online component and the other pieces, there's ways to really delve into the information, become familiar with what it means to sustain. What are some specific examples? The tool itself can be there, but really using those assessment scoring and the whole suite of options can really help people plan for this sort of work moving ahead. And then we're hoping, of course, in this next year, that should probably say more like 2020, that with all 25 of our clinic systems and 100 clinic sites, we will be actively engaging in this information and moving ahead to really use all of the resources that clinic systems and sites can consider. How do they really sustain the navigation efforts? And what I will say is that this is imperative in Colorado, because we know that we are not going to be funded in perpetuity for our navigation statewide efforts, and we know that people are really looking for this sort of service to be sustainable. So with these components that we've built out, it's been essential and I think very critical, and been more than helpful for us in the work moving ahead. We have developed this curriculum, the facilitated discussion, and all these components to help in implementation. And I have provided those resources that if you are interested in, beyond the assessments, beyond the existing tools, and having those facilitated discussions about how to implement in your community, we have, with resources from the NCCRT, developed this work, and there are ways that we might be able to help provide that technical support with the funding that's been provided from us for at least the foundation of the work. So that gives just a general overview of what's been created. I'm going to pass the baton over to Victoria, who is now going to talk a little bit about being someone who's not as engaged in all of the development, but has been definitely on the advisory committee and is now really looking to what they're doing in Iowa to talk further about their efforts.
Great, thank you, Andy. Can you guys hear me okay? And then see the slides that I have?
Yes.
Okay, great. Well, thank you for that overview, and I'm going to shed some light on what we have been doing in Iowa and how we've been using this new resource to guide our conversations with our centers. And so, again, I'm Victoria Renton. I work in Iowa, managing our colorectal cancer program. And I first became involved with this resource after meeting Andy and attending the National Colorectal Cancer Roundtable. And I really wanted to be part of the development of the online resource so that people like myself in public health could enhance our own skills and knowledge as we're working with these health centers. So we've been using the resource to review the online assessment, and what we did is we pulled questions from the website before it actually became live, and that helped us hold these guided conversations with the health centers. We did this in person to assess where they were at year 4 of our grant funding, and then planning their future TA needs. And so looking at this next slide here this is an example of some of the questions that we pulled from the online assessment. And what I liked about having the toolkit online is that it was proven questions and assessments that were adapted from a reliable source, and that, we didn't have to start from ground zero thinking of questions to ask. And even the sustainability planning, coming up with those questions, I didn't even know where to start. So it was really helpful for me as a public health planner and somebody managing a program to tap into this resource. And so this is just some of the questions that we had put on an agenda with each of our 6 health centers in Iowa, and then we did in-person conversations. And it was pretty exciting because a lot of the responses we got out of the questions we asked, it wasn't what I was anticipating. And then it led to, oh, well, wait, there's a bigger problem here. Now, maybe we should be looking at our data analyst, who's pulling the data. So it really helped guide that conversation. When we, sorry, going the wrong way here. When we look at next steps, right now we're partnering in the last year of our federally funded grant with the CDC. We're partnering with the Iowa Primary Care Association. And so we're going to take those on-site visits a step further, and we're going to expand beyond just meeting with the QI directors and the patient navigators. We're going to be meeting with the clinic leadership, the MAs, IT, fiscal, front desk staff, anybody throughout the process in the clinic who has their hands in with, whether it's distributing the fits, navigating patients to a GI center. We're going to get them in, and we've been told it will be about 6 hours of going through all these folks and asking them questions, and a lot of it will tie in with the online assessment. The goal is really to strategize, similar to what Andy was talking about, is to strategize with the centers and determine what are your key needs over these next 12 months of grant funding that we can figure out and we can begin to address. Maybe it's the workflow and getting a clinic champion on board to help sustain patient navigation. And so this is just kind of a brief overview on what we've done so far and how we've used the resource. And I did want to show, Andy, when we were on your website, I want to pull that up really quick. Can you see my screen okay? Okay, good. So when Andy was talking about the assessment, it's right here. And then you don't even have to log into it or even start answering it. You can just start looking at questions. Like when I was talking about champions, that's one of the big areas that CDC has realized through their year one of our colorectal cancer program that you need a champion on board in the clinic to move things forward. And so a lot of really well-worded questions here that you can pull from. And honestly, it gave me the confidence to know that I was asking legitimate questions. So I'll stop there and hand it back over to Andy.
And Victoria, before we completely stop there, actually, if you don't mind, just because I think it might be pulling up a little more easy on your site today, if you can kind of hit the, go back to the site, and then we'll go back if you want to pull up the website again, and we can actually move to the accreditation measure. And Chastity Dolbeck, who wasn't able to join
us. And I'm
us,
happy to take any questions too as we're transitioning.
Okay, Victoria, can you hear me okay? Victoria, can you hear me? Erin?
Yes.
Am I on mute? Okay.
Nope.
Okay, can you hear me okay?
Yes.
Okay, great. So Victoria, that was awesome. And Victoria, I wondered if you could go ahead and pull up the site again, because I think it might just actually be working a little bit easier on your side really quickly. When we were, Chastity Dolbeck, who wasn't able to join us today, who was ill, shared some of her perspective, and I think some of the great things that she had shared about the actual tool itself. And Victoria, I'll have you go up to the accreditation section, and we'll just quickly talk about this. But in terms of looking at the quality and accreditation area too, and I just love to just point this out quickly as you scroll down. Ultimately, Chastity, who really helped provide insight, had actually even talked a little bit further about the work that they had done around the triple aim and how patient-centered medical home and their perspective. And Chastity has been a leader in this field. And I'm not sure if we'll have time to, and actually if the sound will play at this point. But one of the things that I think has also been great is when we look at the thought leaders and people who've done this work, there's those opportunities to hear the work, hear what they're doing, giving their perspective as well, in addition to reading the information that's here. But even in this specific site, we've been able to talk a little bit about around certain settings, what are the areas for opportunity for showing the value and benefit of accreditation and quality, and that's how that's helped lead to sustainability. So I really want to just give a huge shout out for Chastity, who's been part of our team who wasn't able to attend, and just give a nod to this specific chapter. And even within the Quality and Accreditation Toolkit, she's given a lot of leadership in understanding what are the specific areas where cancer screening navigation has been essential to showing some great benefit to their health systems, and they've been able to sustain navigation. So we'll leave that portion right now, but thank you, Victoria, for making that, that linkage right there. So again, everyone, I just really want to say give some time to really look at the toolkit itself online. I think it's probably the easiest lift to really thinking about what are those fundamentals that people should consider. The actual hard copy will then get into more of this brass tacks and details and some very specifics that are really helpful as well for you all to consider. So I'm going to go ahead and share our screen, and we're going to wrap up here just shortly, and just talk about a few of the other resources that have been, I think, essential to the work that's happening. And Erin, can you see my slides right now? Yes.
Yes. No.
There we go. There we go. Okay, and we will. So let me pull this up really quickly. And I did want to talk about some of the other. Erin, are we good now?
Sure, with the Navigator Roundtable slides.
Yes. So I just wanted to also note that I think a number of the National Navigation Roundtable members are also very much interested in sustainability topics. For people who are attending today, looking at payment policy, workforce development, that have really been critical to the NCCRT work in this toolkit, this is another great resource for us to consider. The other thing, I think, because we do often get many questions from folks about what are the existing national resources related to that implementation work as it pertains to the actual workforce development of navigators. I did want to give a shout out to the Patient Navigator Training Collaborative, who was also our key partner in developing the online module, the curriculum, and helped advise also on the development of the toolkit, that in terms of looking at a national team who's done work around the fundamentals of navigation for a number of disease types that have also been really engaged in the cancer screening area, working with our team here at the University of Colorado Cancer Center School of Public Health and others, that this is a fantastic resource. There are online modules, there's in-person components, there's online learning opportunities as well, and some specific work around motivational interviewing, care coordination, supervisor training. And I know that's something that from our previous webinars, people are saying it's great to learn about sustainability, but we still have a lot to do in workforce development. So I really wanted to give a shout out to PNTC. On the left shows a little bit of where these alignment of level 1, level 2, just to give a bit of a picture. I would say that probably in about 10 to 15 different states, we've done implementation training around navigation. But I think that Lynn Butterly and her team, with the support from the Cancer Control Program in terms of the implementation model and replication model, one of the key parts of sustainability of navigation for colorectal cancer has really been also showing the value and quality of navigation. And I think both the work that CCSP, the PNTC, as well as what Dr. Butterly's implementation guides show, really focus on making sure that patients are adequately navigated, and we know that better show rates, better prepared patients, and patient satisfaction are amongst some of the best things to really help support in terms of quality measures. So I just want to really note that this is something that we should consider as well. In addition, the GW Cancer Institute, with support, I think, from PNTC, has some great online modules around cancer navigation, not just cancer screening navigation, but just cancer screening, or excuse me, cancer navigation at large, and have been a leader in the field. So I would be remiss if I didn't miss that as well. And the one thing I would say is this: I think with the National Colorectal Roundtable, we have devoted resources to this new development of an online tool, updating the current hard copy of the tool. Over 120 people have been very engaged in these efforts, but their tools are only as good as they are utilized. And I think Victoria did a nice job of showing that there is something for everyone on the tool, even if it's not adapting or integrating exactly as other states. The full complement of all of the assessments, not necessary, but good food for thought and really good things to really start planning. Because again, I really think the expectation is that navigation and sustaining navigation moving forward is something that most health plans and funders are really either considering should be done, or we oftentimes will be able to rely on foundation and grant support. But we do have a lot of the essentials, as we saw around that, those core areas for us to really make the sustainability cause. So I would just say, in terms of if you're considering what to do next based on what we provided, check out that online tool, give it a whirl. No chapter 1 is any too long. You'll get a sense from what we mean by sustainability, things you might consider. Consider what you're doing well, what you're not doing well, maybe what needs some improvement, maybe what's gotten lost in the storm. Use that assessment tool as a way to really consider it. Those assessment tools, when you do go through the full response, those will actually be emailed to you directly so you can see real time what your scores are per se. And again, there's no right or wrong. It's just showing you ultimately areas that you might want to consider some extra resources and time and devotion, and areas that you're doing exceptionally well. And it's awesome to celebrate those as well. I think the other thing is really thinking about engaging your team in the work. So we've developed some awesome tools with tons of people from throughout the country. Utilize those, but really in getting those in front of your team is going to be essential. And dig more into the actual toolkit itself to think about the tools, replication models. There's things like job descriptions, policy briefings, a number of things that can really help think about where you are, and you don't have to necessarily recreate the wheel. And I think that's something I heard Victoria say as well. And then if you are very much interested in technical assistance and support in this area, you know, CCSP in Colorado, we are doing this with and for our grantees. That's part of our grant. But with the resources we received from the National Colorectal Roundtable, we're also able to really look at how do we come with some developed approaches to work with folks who really want to put in these essential steps to thinking about growing and sustaining their work as well. So I'm going to actually turn it back over to Emily and just go ahead and stop sharing my screen. And I apologize for that quick blurb of the 3 to 4 minutes where we had the online tool that just didn't show up there for a second. But Erin and Emily, I'm going to turn it over to you for the last 5 minutes to see if there's any specific questions that we have coming forward.
Great, thank you so much. That was just fantastic. So just a reminder, everyone, the chat box is, you should either see an icon at the bottom of your screen or to the left. So please start filling in your questions there. And while we're waiting for those to come in, I do just want to share a huge thank you to Andy and your team. You've put so much great thought and hours, sweat, hopefully no tears, into these resources, and they were just fantastic. So thank you. And then big thank you to Victoria, Chastity, and everyone else who contributed so much.
Yes, and I do see there is a specific question, will the slides for presentation after today's meeting? And yes, they certainly will. We will provide those as well. And I do actually, because I know on occasion that there are questions specifically about some of the resources that have been developed. Patty, you're on the line as well today, correct?
Yes, I am.
Great. Patty, is there anything, I guess, based in this process and all of us working together, anything else that you'd like to share, I guess, about this sustainability suite of options overall?
Just that it's very tailored to the needs of your agency, and the training as well. So I think that's what is the kind of innovative and exciting aspect of this whole sustainability toolkit, is that you can kind of pick and choose or do the assessment, and based on the assessment then decide what you need to work on further or bring in a trainer. So I think that's really exciting.
Yeah, thank you, Patty. Any other specific thoughts, or Victoria, closing thoughts from you?
Yeah, I think just reiterating the fact that you don't have to reinvent the wheel. That's what's so great about this resource, is you guys already did all the work and all the research, and it's all there. And so I'll continue to use it and work with our program with it. So thank you for doing all the legwork.
Yes, and a huge thanks, I think, to the NCCRT. I think, as Emily said, there weren't really tears, but on occasion there were some times where we would be in specific areas in the toolkit waiting on someone to provide some great data or tool, only to have someone say, you know, you can, it'd be awesome if you would do this, but we're not done publishing the data, or we're not quite there yet. And it really was, I mean, it's really a work, real-time, in-process type opportunity. And I will say that we are going to continue to update this moving ahead, and, you know, try to continue to make sure that it is relevant. And I really would just also encourage that if there are folks that really want to think about further how to utilize this work, please give us a call. I know Emily and Caleb and the NCCRT are very excited about making sure that all of the resources are utilized from the roundtable. So if you have ideas about how to integrate this to work, you want to really expand, pilot this in specific areas, let us know. The question came in from, can this tool be utilized for FQHCs who may not currently have a CRC patient navigator and would not necessarily have a big enough population to support this role. So that is a really good question. And I'd love for some of my other folks on the team to also talk as well. Here's what I would say. I think as I mentioned, when we talked to our team at university or WashU, we basically said, is there ever a time that you shouldn't consider sustainability for the program? And it was basically like, unless everybody hates the idea, then that's about the only time you should not think a little bit about it. But I would say that from your components there, it might be really good to even run through that assessment and just think about where you are right now, like in terms of thinking about, could you have a navigator? Would there be enough support in these specific domains? And it's maybe not something you could plan and do straight away, but it might be a really good key for thinking about what you need to do in terms of having policies in place, thinking about where funding would come from. Do you have the right type of organizational capacity? Do you have clinical support for this? And then really consider if you can implement navigation or navigator within your system. And Tamar, I'd be willing to talk offline with you a little bit about that as well. But I think using these fundamentals and seeing what other states have done as well would be essential. So if you look at the other states and regions and the like, there's a really nice Q&A that talks a little bit about how they've also tackled this specific discussion. But Victoria, I'm sure that even within Iowa, this is something you're considering. Do you have anything else to add?
Just to that question is, I think, even if you don't have a designated patient navigator, my question back is as you're using this resource to think, are there people in the center that are actually doing that work but aren't defined as a patient navigator? That's all I have to add.
Okay. All right. And Patty, anything else to add to that as well?
No, just reiterating what you said about sustainability, or at least planning and thoughts around sustainability should be started even during program planning. So I agree, it's never too late to start when you're developing and implementing a program.
Mm-hmm, for sure. So everyone, I think again, we are going to hopefully, I know the Roundtable has been doing a phenomenal job of supporting development of these resources, tools. Again, I think my hope and feeling is we do have the list of folks who've joined in today. As we see other opportunities to provide additional technical assistance, more case studies in this area, showing you how these tools have worked, integrating, we'll try to give you as many updates from our respective programs. And of course, if the Roundtable is engaged in more of this work, we hope to continue this work with you all in tandem. So thank you so much. Emily, I will give you the final word, and a million thanks everybody. I think we had about 60 people on and still 50. So yay, that's a good thing. I appreciate it.
Yeah, just huge thanks again to everyone and for your participation and everyone that contributed. I'm sure many of you are on the line. I just wanted to let you know again, we'll be sending out an evaluation. Would appreciate your feedback. We'll be posting the replay to the itsacrt.org website within a couple days. And then just wanted to put a plug out for our next webinar, which is going to be July 16th, same time, 2 p.m. Eastern, in which we'll be releasing the newly updated communications guidebook, which includes market research tested messages to promote colorectal cancer screening. It's going to be awesome. So hope you could join in and hope to see you next time. Thank you.
Right. Everybody have a great day. Thank you.